Good afternoon, everybody. It's Ben here from Doveston Health in Morayfield. For anybody that's watching this video, whether it be a current or past patient or a future patient, Doveston Health is an allied health clinic in Morayfield, and we provide a range of services such as physiotherapy, exercise physiology, podiatry, nutrition and dietetic advice. Throughout this week, we've kept our community and patient database updated via email. I myself personally have been bombarded with blanket emails offering to provide information about COVID-19 and the coronavirus. Some useful information in there, but a lot of it is not so much. I felt that the following update would probably be best communicated through video, with the primary purpose being to discuss our operations moving forward, not only as a health practice or a business, but more so as compassionate human beings. We're trying to strive to do what's right, despite the direct impact that this pandemic's going to cause us as individuals and as a team. I'll explain what this means for our patients, our staff, their family, friends and their loved ones. As you should all know by now, the world is unfortunately having to deal with the stress of the coronavirus, otherwise known as COVID-19. It's now a global pandemic. There's a lot we do know about COVID-19, but the scariest part of it all is what we don't know about the virus. So Doveston Health, as a practice, has for the last 2 months been ramping up safety procedures in line with the current standards and guidelines put forward by the government and other health organisations. We've really maintained timely communication with our patients regarding COVID-19 to ensure that the risk of spreading it and transmission is dramatically reduced when attending our clinic. It seems, however, that even our team following strict protocols that we've put in place, we still can't be 100% certain that the patients and other people who have been presenting to the clinic are also adhering to these high standards of hygiene. And this is where we are seeing a gap and everything's starting to break down a little. Despite the government instructing us as a country daily about what businesses and services are to stay open and which are to cease operation, they still have the responsibility of addressing both health and economy and consider those two things at the same time. This is very difficult, and I don't think anyone can arrive at a solution that mutually addresses both parts of that. Despite the Prime Minister defining our business, service offerings such as physio, EP, dietetics as essential services, these face-to-face consultations pose just as much of a risk, if not higher risk of transmission in comparison to other services that have already been forced into closure. Some examples being gyms where we can safely implement social distancing guidelines. We can also wipe down equipment, sanitize our hands. Compare that to a physiotherapy practice where hands-on treatment is required for a lot of patients. It's near impossible to implement that. So the messages are mixed and confusing to the general public. Our practitioners can't safely practice social distancing whilst maintaining best practice. It's just impossible. So at this point in time, our team has acted more from an ethical and a moral angle, and we as compassionate and dedicated health professionals don't want to be responsible for adding to the pandemic. We don't want to place ourselves, our families, or our patients at risk, or our patients' families and friends for that matter. With symptoms often not presenting until 10 to 14 days after the contraction of COVID-19, what we are told by the government and what we understand to be working now may in fact lead to a larger and more detrimental result in weeks to come. I guess for me as a father, a family man, a business owner, and employer of a lot of staff, I don't believe there's any option but to close Doveston Health for the reasons I've mentioned already. To remain open with the justification and mindset that I'm providing jobs and boosting the economy would, in my opinion, be selfish. These so-called essential services can only stay operational if the essential staff provisioning these services stay healthy. If the current situation worsens, which it is and will continue to, even essential services will be unavailable. So it is with a very heavy heart that the team here at Doveston Health does close its doors today. We had to make that tough but necessary decision to shut down. We will resume in-clinic treatments when we can ensure the safety of our staff and patients can be preserved. We are We're willing to do this to keep our patients, their families, and as I said before, their loved ones, as well as us and our families safe. We really do love seeing everyone in our clinic, and yeah, with the strictest hygiene guidelines in place, and even trying to stick closely with the social distancing procedures, we still can't 100% guarantee that health issues won't arise from lots and lots of people coming through the clinic each day. A lot of patients are asking, what now that the patients that we have called today and had to cancel appointments at short notice. We're closing the doors. We will be implementing telehealth options for all patients who have physiotherapy, dietitian, diabetic education, exercise physiology sessions if you're eligible. So we hope this platform's active from Monday the 30th of March with a seamless transition to that. The remainder of our week is going to be communicating this sort of stuff to patients and getting our practitioners trained up to use the telehealth platforms to make sure that it's an effective form of delivery. I guess this option allows us to still communicate with patients via phone, internet, or video, depending on what the patient has access to. This way we continue to keep everybody healthy at the best of our abilities. We're not closing forever. I think that's another confusing point for some patients. I want to strongly emphasize that we are not closing our business forever. This is only a short-term action plan. We'll be back as soon as we can ensure it's safe for our staff and patients to return. We will be in contact with patients who are booked to advise them of the changes and what the next step is in their treatment. I really encourage patients and people who might see this video, if it's been shared, to keep an eye out on our social media pages, our website, and also fax and email updates as we roll this plan out. We wish to have everybody that's part of the Doveston Health family extended to stay safe and keep a positive mindset during this difficult and ever-changing time. So stay tuned. We'll keep you updated as best we can. And yeah, look after yourselves.